Polycystic ovary syndrome, or PCOS, affects up to almost 27% of women during their childbearing years. It involves cysts in the ovaries, high levels of male hormones, and irregular periods. Many people are unaware of the fact that they have PCOS, and this causes several complications for them in pregnancy and in other stages of life. But some very simple lifestyle changes, knowledge about this disease, and overall consciousness can help you overcome PCOS. Researchers have said losing just 5 to 10% of your body weight if you're overweight can help you improve your symptoms. So today, we will guide you to learn all about polycystic ovary syndrome. What is PCOS? PCOS is a problem with hormones that affect women during their childbearing years, usually through the ages of 15 to 44. Many women have PCOS but don't know it. In one study, up to 70% of women with PCOS hadn't been diagnosed. PCOS affects a woman's ovaries, the reproductive organs that produce estrogen and progesterone, hormones that regulate the menstrual cycle. PCOS is a syndrome or a group of symptoms that affect the ovaries and ovulation. The three main features are cysts in the ovaries, high levels of male hormones, irregular or skipped periods. In PCOS, many small, fluid-filled sacs grow inside the ovaries. The word polycystic means many cysts. These sacs are actually follicles, each containing one immature egg. The egg never mature enough to trigger ovulation. What causes PCOS? Doctors don't know exactly what causes PCOS. They believe that the high levels of male hormones prevent the ovaries from producing hormones and making eggs normally. Apart from these, genes, insulin resistance, and inflammation have all been linked to an excessive production of the hormone androgen. Genes. Studies show that PCOS runs in the families. Researchers also say that it is likely that many genes, not just one, contribute to the condition. Insulin resistance. Up to 70% of women with PCOS have insulin resistance, meaning that their cells can't use the hormone insulin properly. Insulin is a hormone that the pancreas produces to help the body use sugar from foods for energy. When cells can't use insulin properly, the body's demand for insulin increases. Extra insulin triggers the ovaries to produce more male hormones. Obesity is known to be a major cause of insulin resistance. Both obesity and insulin resistance can increase your risk of type 2 diabetes. Inflammation. Women with PCOS often have increased levels of inflammation in their body. Being overweight can also contribute to inflammation. Studies have linked excess inflammation to higher androgen levels. Symptoms to watch out for. The most common PCOS symptoms are irregular periods. A lack of ovulation prevents the uterine lining from shedding every month. Some women with PCOS get fewer than 8 periods a year. Heavy bleeding. The uterine lining builds up for a longer period of time, so the periods you get can be heavier than normal. Hair growth. More than 70% of women with this condition grow hair on their face and body, including their back, belly, and chest. Acne. Male hormones can make the skin oilier than usual and cause breakouts of acne on areas like the face, chest, and upper back. Weight gain. Up to 80% of women with PCOS are overweight or obese. Male pattern baldness. Hair on the scalp gets thinner and fall out. Darkening of the skin. Dark patches of skin can form in body creases like those on the neck, in the groin, and under the breasts. Headaches. Hormone changes can trigger headaches in some women. How is PCOS diagnosed? Doctors diagnose PCOS if women have at least 2 of the 3 main symptoms: high androgen levels, irregular periods, and cysts in the ovaries. A pelvic exam, blood tests, and ultrasound can confirm the diagnosis. Your doctor should also ask whether you've had symptoms like acne, face and body hair growth, and weight gain. A pelvic exam can look for any problems with your ovaries or other parts of your reproductive tract. During this test, your doctor inserts gloved fingers into your vagina and checks for any growths in your ovaries or uterus. Blood tests check for higher than normal levels of male hormones. You might also have blood tests to check for your cholesterol, insulin, and triglyceride levels to evaluate your risk for related conditions like heart diseases and diabetes. An ultrasound uses sound waves to look for abnormal follicles and other problems with your ovaries and uterus. Treatment for PCOS. Lifestyle interventions are the first treatments doctors recommend for PCOS, and they often work well. Weight loss can treat PCOS symptoms and improve the odds of getting pregnant. Diet and aerobic exercises are two effective ways to lose weight. Birth control pills and other medications can help you regulate the menstrual cycle and treat PCOS symptoms like hair growth and acne. Birth control. Taking estrogen and progestin daily can restore a normal hormone balance, regulate ovulation, relieve symptoms like excessive hair growth, and protect against endometrial cancer. Metformin. Metformin is a drug used to treat type 2 diabetes. It also treats PCOS by improving insulin levels. Hair removal medicine. A few treatments can help get rid of unwanted hair or stop it from growing. Laser hair removal and electrolysis can help get rid of unwanted hair on your face and body. Surgery. Surgery can be an option to improve fertility if other treatments don't work. Ovarian drilling is a procedure that makes tiny holes in the ovaries with a laser or thin heated needle to restore normal ovulation. Home remedies. You may be able to manage the factors causing PCOS and ease your symptoms through lifestyle changes and dietary supplements by implementing these methods. Diet changes. Eating the right foods and avoiding certain ingredients may help you manage your symptoms. Unnourishing diet can help regulate your hormones and your menstrual cycle. Eating processed, heavily preserved foods can contribute to inflammation and insulin resistance. Exercise. Gentle, low-impact exercises like yoga or Pilates can be practiced for longer duration. Swimming and light aerobics are also recommended. High-intensity interval training and long-distance running may also help improve symptoms of PCOS. Maintain sleep hygiene. Sleep affects your stress levels and help regulate cortisol to balance your hormones. But sleep disturbances are twice as common for women with PCOS. To up your sleep hygiene, aim for 8 to 10 hours of sleep per night, establish a regular bedtime routine, avoid stimulants and rich fatty foods before bedtime. Remember, you are not alone. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe and stay healthy and let your voice be heard.